Okay, so here we have all of the supplies ready for a tray of injections. I have my gloves here on top. If I flip over my towel, I have 3 sets of syringes set up with needles. This one is your 29 by 1/2 gauge needle. This is an insulin syringe, so we'll use this one for an intradermal injection. We have a 25 by 5/8 needle along with a 3 cc syringe. We'll be using this for a subcutaneous injection. And then the last is a 25 by 1 gauge with the syringe attached. We'll be using this for a deltoid injection. I also have the setup for each injection here on my tray. I have an alcohol prep and 2 gauze. And then I also have the same setup for injections 2 and 3. We also have 2 bandages. We only need bandages for our deltoid. For our subcutaneous injection, we do not need a bandage for our intradermal. The first thing I'm going to do when I set up my syringes is I'm going to pull out extra alcohol preps for cleaning the top of my multi-use vial, this rubber stopper. We're going to clean each time before I prepare a new injection. You do not have to have gloved hands while you're doing this. It is assumed that you already have washed your hands with aseptic technique before you begin this process. Now, what I'm going to do is I'm going to breathe the plunger, pull my plunger up and down, and make sure it stops sticking inside the chamber of the syringe. What I am going to do is measure out that 0.3 mLs, which you're expected to measure, and I'm going to pre-measure like that with air in the syringe. Then I'm going to remove the top, clean my vial with the alcohol prep, put off to the side, and I'm going to insert my needle straight like a 90-degree angle, and carefully I'm going to support my hand underneath the vial. I'm going to inject that air into the vial, and I'm going to draw back on my plunger, appropriately loading the correct amount of medication that I need for the injection. As soon as I come out with the needle, I'm going to set my lid here and recap my needle safely, taking my other hand away so I make sure I don't poke myself, and secure the lid onto the syringe. Then I'm going to prepare my injection, make sure there are no bubbles, make sure there are no gaps of any space inside of the syringe, and I see a bubble here. So I'm just going to take my pen and gently hit the syringe one more time, get rid of that bubble in that air pocket, push my plunger back up to the appropriate level, the 0.3 mLs, and this syringe is ready for injection. I'm going to repeat that same process for the next 2 syringes. So I'll unpackage my 3 cc syringe, I'll unpackage my 25 by 5/8 needle now, and again, this is the one to use for your subcutaneous injection. I'm going to clean off this rubber stopper on the multi-dose vial again. Uncap my needle very safely. Again, I'm going to pull down and breathe the plunger to get it unstuck. Measure out the 0.3 mLs. Another 90-degree angle, stick the needle inside, and then again support. Draw up that medication. And recap immediately as soon as you come out of the vial. The last syringe is the 29 by 1/2, which is the intradermal syringe. Now for this one, the unit of measurement is different. We will measure 30 units into this syringe. And again, I'm going to wipe off the top of my multi-dose vial with the alcohol prep. I'm going to pre-measure out 30 units on the syringe. Again, bleed the plunger to make sure it's not stuck. 30 units here, uncap. Be very careful with this needle because it is a little bit more delicate than the previous 2. Inject that air into this vial and draw back on your syringe to load it with the proper amount of medication. And recap as soon as you come out. Okay, Now that my tray is set, I've double checked my syringes, making sure there's no bubbles, no air pockets. I'm going to go ahead and glove up and get ready to administer my injections on my patient. The first injection I'm going to perform is a deltoid injection. The way we're going to locate the muscle, the deltoid muscle, is located right about here on the arm. The way we measure this off is I'm going to find my patient's acromion process, the end part of the clavicle. I feel that bony projection right about here. I'm going to go about 3 to 4 finger spaces downward from that point, and that's going to give me a good spot locating the deltoid muscle. First part I'm going to clean is with aseptic technique using my alcohol prep. I'll start in the center and work my way out 3 times. I'm going to use one gauze pad to wipe down and dry that area that I've just cleaned and put it on the dirty side of my tray. Then I'm going to uncap my syringe. I'm going to locate the bevel, the opening of the needle. I'm going to go ahead and hold my needle like a dart, pinch my patient's deltoid muscle, squeeze, insert the needle all the way, anchor. I'm going to aspirate and inject. Put my hand back onto the syringe. I'm going to take this hand away completely, withdraw, and hit the safety immediately. After that injection is complete, I'm going to take my remaining gauze pad and massage in that area. The last step in this process is to put a bandage on my patient in that spot that you poked. The bandage here. Okay. And now if you would have your patient kind of turn their body and tilt it a little bit more towards the left, I'm going to aim for a subcutaneous injection, which is in fatty tissue. So for this injection, I'm going to aim towards the fatty muscle, or I'm sorry, the fatty tissue on the back side of my patient's arm. I'm going to use the same technique again as our deltoid injection. We've just changed locations. For this, I'm going to pre-measure out from the end of my patient's armpit. It's going to be about 2 or 3 finger spaces below that point, and I'm just going to kind of position my hand like this to locate my correct spot, which is going to be right about here. So again, I'll use aseptic technique to clean 3 times out, and then I'm going to wipe dry. I'm going to uncap my subcutaneous needle, which is that 25 by 5/8. Locate the bevel of my syringe, and then I'm going to hold my syringe at a 45-degree angle. I'm going to pinch my patient, insert the needle, again anchor, aspirate to make sure we've not hit a blood vessel, inject, hand back onto the syringe, withdraw, and safety immediately. For this injection, you will also massage the site, work the medication into your patient. And just like the deltoid injection, we'll also bandage our patient in this area as well. Okay. In the last injection, I'm going to ask my patient to step down off the bed and circle back around. The last injection will be an intradermal. We want to isolate our patient's forearm. I'm going to go on the top side of the forearm, so the very top of the forearm. I'm not going to go on either direction too far into the side. We need a wheel to form and appear and be very obvious, so that's why I'm going to choose the very top of her forearm. I'm going to be very careful to avoid blood vessels. Again, MAs cannot give injections inside of a blood vessel, so we need to be very careful to avoid. I'm going to clean again with aseptic technique 3 times around. I'm going to wipe dry with one gauze. I'm going to uncap my 29 by 1/2 syringe. And for this injection, what I'm going to do is I'm going to stretch the skin taut, hold my syringe just like this, insert my needle just past the bevel. Once I have it securely in my patient, I'll let go of this hold, and I'm going to start to inject on the plunger. And I'll see this nice wheel forming. Going to inject about 10 units in total. Once I'm done injecting 10 units, I'll go ahead and withdraw. and apply the safety on the edge of my tray. For an intradermal injection, we leave it just like this. We do not bandage and we do not wipe anything away from the site.